Okay, I think it's time. Hello and welcome to our next webinar. Today we'll talk about using coMra therapy to treat cats and dogs. Now this is hugely exciting topics, and as you may know, through the years we've covered a very wide range of conditions, diseases, but mostly about humans. Now we do have several webinars. We did on horses, we have a webinar on dogs, and we'll put in the description of the video, if you'll watch it later, links to those webinars as well. But today we decided to talk in general on using coMra therapy for cats and dogs. Now, you may already have a coMra device, a Delta or a Palm, or perhaps you are looking for a therapy to treat your pet at home, or perhaps you are a professional, a veterinary doctor. So we hope you'll find this information interesting, and we'll cover today several key topics. We'll talk about what's coMra therapy, coMra devices, the principles of application of coMra devices, and we'll take a look at several specific cases. And I made a selection of different various cases that you might find interesting, and on those cases I will illustrate application of coMra therapy and what kind of results, what kind of benefits the animals were getting. So when we talk about coMra therapy, coMra therapy is a device that combines four non-invasive, non-destructive therapeutic radiances. So on the left you see a device called coMra Delta, and it has four radiances, as I mentioned: infrared laser, magnetic field, ultrasound, and color LEDs. So, and on the right picture you see a cat with a device called a coMra Palm. It has three radiances: infrared laser, magnetic field, and color LEDs. So these devices can be used both at home and in a professional setting, like for example in the veterinary clinic. You can also take them with you on the road if you need to. But these devices is a whole new way of thinking of health of our pets. I need to mention that in this webinar we'll talk about small animals, pets, cats and dogs, other small animals, a little bit about birds, and we will not talk about today about bigger animals, horses, cows. Now these are different anatomies, slightly different diseases, so perhaps now, if they'll be interested, we'll cover them separately, and we already have one webinar on horses. We'll put a link in the description. So today we'll focus mostly on cats and dogs, and usually these are the most frequently asked questions. How do we treat these animals? So these two devices, again, they have a very wide application. Why? Because coMra therapy, remember, coMra therapy is not aimed against a specific disease, a specific condition, like for example inflammation or pain. No, coMra therapy is aimed to support the natural healing or regeneration of the body itself. So what we do with the device, when we place it on an injured organ, on an animal, we help the body to efficiently accelerate its own healing. That's what we're doing. That's why we can apply coMra therapy not only on humans, but also on animals. and the general principles of application would be very, very similar. So over the years, we've collected a number of different clinical cases, and we used on different animals coMra therapy, and we have reports from all over the world. So, but now in 2023, this year, we decided to combine our experience in form of a new user guide for cats and dogs and other small animals. So it's in the works. It's not yet ready, but in 23 it will be published and released. And in this work, I met a veterinary doctor from Altai Agricultural University. It's not far from here where I'm currently living. Her name is Ulyana Marshalkina, and we met through this dog. You will see his name is Lance, and I'll share his story just now. So Ulyana has been using coMra therapy during the last year and a half, and she's super enthusiastic about coMra therapy. And basically she helped me to combine together all our experience in form of the protocols, and I will share later some of the examples of those protocols. So this is now currently in the works. Now, some general guidelines before we get to the specifics about protocols, how you treat these conditions, how you treat that condition. Now, when you have animal at home, cat or dog, obviously, they don't talk to us as what, for example, a human being would do. So how do you know that the animal is not well? Well, you need to observe your behavior. You look how it's eating. Is it playful, and so on. So actually, when you think about it, because the animal cannot just simply talk to you and complain about pain here or there, actually you are the main expert, the owner of the pet, the main expert on health of your cat, of your dog, of your parrot, guinea pig, and so on. Because even when you bring a pet to the veterinary clinic, something you see something like really wrong, clearly, for example, cat is sick, the doctor still will have to question you about the animal. Why? Because when you bring a cat into the clinic, the cat will behave either super agitated, or it will be depressed, it will be scared, so it will react abnormally. And the veterinary doctor has to be super skillful in order to tease out, to understand what is, going on with the cat. Or they'll have to order a whole battery of different tests, MRI images, X-ray, blood tests, and so on. So really, you are the main expert. And what you'll be doing is that you'll be just observing the behavior. For example, any animal, when it's just getting sick, getting ill, it will become more quiet, less playful. Sometimes it will go and hide. You have to go and look for it. Why? Because it's instinct of the animal. It will go and hide in some dark corner. Why? Because it's avoiding noise, it's avoiding exposed places. Instinctively, it will seek a protected shelter and crawl there and try to rest and until it gets healthy. So, or for example, you can see it's not eating well and so on. So just observe the animal, and as soon as something is really going on, you suspect something is off, you can already apply coMra therapy. And this is the beautiful thing about coMra therapy, is that you don't have to know the exact diagnosis. You are not afraid to apply the device because remember, in coMra Delta, in coMra Palm, the radiances, the energies that we use in the device are really low intensity, and you will not harm the animal. In the worst case scenario, if you put it on a healthy organ, simply nothing will happen. Nothing bad will happen. So, and this is one of the problems that a veterinary doctor will see, is that typically they will bring animal to the clinic and it's already really sick. The disease already advanced, and it's more or less emergency situation. So with coMra therapy, your focus really should be on preventative approach. For example, some breed of dogs, let's say a Labrador, and I'll show an example later, or some bigger dogs, they would have problems with the joints, with the hip joints. Some cats have heart problems. We also know that, for example, as the animal will be aging, it will be prone to other diseases. Other situation would be, for example, when you need to take your, let's say, cat for a vaccination. And nowadays, unfortunately, they require these new vaccines coming on the market. I know for a fact here in Russia, not all of them are well tested in terms of their toxicity. And they might have serious side effects. So what you can do is that, you do some universal treatments in advance. Let's say 1 week in advance, you do universal treatment. I'll talk about them later. And you can prepare the cat, for this immune attack or immune load in the system when the cat is vaccinated. So basically, you can really predict when something is going to happen, or especially if animal is already old and it has a chronic disease. Again, you don't have to wait until the animal is really sick. As soon as you see something is off, you can do general well-being universal treatments, and it's much better approach. So don't delay treatment. It's really important. Another interesting point, which I found really important when you have at home cat or a dog, interestingly enough, they very often copy diseases of their owners. What do I mean copy and how this happens? Actually, a cat or a dog will mimic behavior, the mindset of the owners. And this is something that, for example, Dr. Ulyana shared with me. We've seen, well, in her estimate, we would say up to 80% of the diseases, I'm not talking about injuries, but diseases, would be correlated really well with the animals. For example, inflammation of the pancreas, inflammation of the kidneys, cancer. It's another. Ulyana noticed at least a dozen of cases in her practice, even in the recent years, when the owner has cancer and let's say a cat or a dog as well. So if you have a chronic condition, have a chronic disease, it's a good idea to consider, treating your pet for the same condition. Now, sometimes it's not a disease, it's more like a behavior. Like, for example, if you're prone to stress, if you have really difficult time at work, you're really stressed out, your cat will start licking itself, or a dog, for example. And sometimes they lick so hard, it's, they lick straight through the fur, through the skin, right into the tissue. It's like actually bloody spots. So you can treat those as well. So when you think about coMra therapy, is that you can really see any injury, disease, or stress on the body. In all of this range of conditions, you can apply coMra therapy. Okay, frequent question is about safety. Can I treat, my cat? Can I treat my mouse? Can I treat horse? And so coMra devices are very, very safe. And when I'm saying safe, is that we treated humans, we treated elderly people who are 80, 90, 100 years old. We treated premature babies. So we know for a fact that coMra therapy is extremely safe device. So you don't have to be concerned at all when you're applying a device to a small animal that you will harm the animal in any way. Now, if you open the user guide and you will read the warning section in the beginning, you will see that we say never aim a device at the open eyes. So this is pretty much the key safety precaution is that infrared laser in the device. You cannot see it, but it's there, and you should never aim it obviously in the open eye of the cat and dog. So sometimes you have to treat the eye of the cat, for example. So what you can do is that you close with your fingers very gently, close the eyelids, and then you can treat around. For example, the heart, the head, the frontal lobe, the eye itself, but you need to really make sure that the eye is fully closed. And then it's completely okay to treat the eye, the head, for example, the nostrils, and so on. So ultrasound. This is one topic that in humans is never actually a concern, but remember that cats and dogs, they can hear the ultrasound. So in a Delta device, you can see here on the photograph, this is a Delta device, it has ultrasound. It's a type of sound that we do not hear, but cats and dogs, they do pick it up. Now, it will not damage the animal in any way, but because they can hear, especially when you do the first treatment, let's say first couple treatment session, they may become restless, they become a little bit agitated. So what you can do is that you switch off the ultrasound for, let's say, for the first treatment session, maybe first couple sessions, and then you switch on ultrasound once the cat is relaxed, and usually you can see the behavior of the animal because they feel so much better after the treatment. They actually love it. They relax. They just lay on your lap, for example. They're completely relaxed. So then you can switch on ultrasound. Now, not all animals do, but some, we observe that they're getting a bit restless. So the next question is regarding the treatment itself. You should be placing the device directly on the animal. You don't need to shave the fur. Just put it directly on the animal, on the organ that you want to treat. And sometimes you will see that the user guide says you need to apply scanning. So what is scanning? How fast you should scan? So I made this video just to illustrate when you are, for example, here what we're doing, we're scanning both sides of the spine from the right, from the left. So this is what we call in the user guide paravertebral zones. And you'll be basically gently gliding the device on the right and then on the left of the spine. So that's it. It doesn't have to be really fast, it doesn't have to be really slow, something, at this speed. It's really simple. Now, obviously, when you'll be treating, let's say, open wound, you shouldn't be touching the skin, the wound itself. You just lift the device off the skin, let's say, 1 centimeter, and you're just scanning over the surface, but without touching the wound. Okay, so this is about the wound. Now about the devices. What kind of devices we recommend? On the right, the device is called coMra Palm, and when it comes to the vast majority of diseases, and especially with the smaller animals, coMra Palm device is by far sufficient. It's really a small device, and when you have an animal at home, you can actually do the treatment at home, several weeks, months at a time, if the disease is chronic. So really, all you need is a coMra Palm. It's a fantastic small device, really portable. You can treat yourself, you can treat the animal. On the left is coMra Delta and the version of it, Delta Pro. This device is more suitable for a clinic because it has, remember, ultrasound, and in the clinic settings, it's not always convenient to bring, let's say, animal for weeks and months at a time, so they have a shorter treatment sessions. So with coMra Delta, you can achieve faster results, and also when it comes to the significant or severe injuries, because the function of ultrasound basically is speed up the restructuring, the regeneration of the tissues. So these are two main devices that we have been using on animals, coMra Delta and coMra Pulp. Now, there are differences in 980 versus 905. I won't be touching it here. If you have a question regarding your specific animal and you're not quite sure, send us email or go to the website and there is a coMra chat, and we'll answer you on your specific animal, specific disease, and I will recommend more exactly to your animal. But these are the general guidelines. Okay, principles. How do we treat? Well, actually, it's very, very similar. If you already have a coMra device at home, you've been treating yourself, for example, you know that first of all, we are placing the device directly on a diseased organ or system. If you have a headache, you'll be placing Delta directly on your head. The next would be blood and lymph nodes, the nervous system, the immunoendocrine system. So these are 4 key principles, and different protocols would be combining these 4 different targets in a different way. So some of the protocols were called universal protocols in the beginning of the user guide. And they are truly universal because we are addressing a well-being of the entire organism, entire body. And then there are specialized protocols, like, for example, traumatology, pulmonology, cardiology, and so on. But really, when we talk about organizing of the treatment and how we select those points, they're very simple. So on this picture, I'm showing you Universal 1. This is one of the, again, universal treatments. And you can see on the right, the picture I put here from the human user guide. You see the points. So point number 1 would be the frontal lobe. And on the left, the same point on the head for the cat and for the dog. The key difference is that obviously the size of the head would be different. Now, the dog would be almost the same as the human head, average human head. The cat would be twice, let's say twice smaller. So instead of 2 points on the frontal lobe, we have only 1 point. That's the only difference. Plus, because the brain of the cat is so much smaller, all you need is 30 seconds is really enough in front of the head. On the head of the dog or a human, it's 1 minute per point. The same principle would be applied to, let's say, the bigger animal. Let's say if you were treating a horse or a cow, we increase the number of points, we increase time per point if we're basically treating a larger organ. And on the other hand, if we treat really small animal, let's say, a rat, you have a rat. So all you'll be doing is just, apply scanning, because it's a such small animal, you're just placing it on a palm, and you'll be scanning the entire body, let's say with the palm device, for 1 minute. And that's really enough for the really small animals, and you can scan the entire body in that 1 minute. That's all it's needed. The same goes for the small birds. 30 seconds to 1 minute, that's all it needs. Okay, so what about the organs? Now, when we'll publish the user guide for the animals, you will see the example protocols for the cats and dogs. But before we have it published, and let's say you want to treat already right now, your cat and dog, and you already have obviously the human user guide. How would you correlate the treatments? Actually, it's very simple. Now in the middle you see the bones, the skeletal structure of the human. And on the left upper picture, it's you have a cow, then we have a sheep. In the middle we have dog, horse, and below we have a mouse. So really the skeletal structure are very, very similar. You just need to basically put a human being on the floor and you'll have the same anatomical structure. And on the right you see the direct analogy. The lungs, the heart, the liver, the bladder would be in a very, very similar location. So you'll be taking a protocol directly from the human laser guide and just in your mind picture it, let's say on your cat or a dog, and doing exactly the same protocol. So it's that easy. Now we do recommend, so you have some understanding what you're trying to treat here, go search online and try to understand what's kidneys are doing, what's heart is doing, what's where is the intestines in let's say in a dog, and so on. This way you can apply coMra device with understanding what are you trying to treat. It's really not that difficult, and once you start treating your cat and dog, and especially after you've treated yourself, it's really not difficult, and we really encourage you to experiment, to try different variations of treatment. Remember, you will not harm the animal. The animal will be completely safe and it will love it. Okay, so let's start with some examples. So I have for the first example a dog, a German Shepherd, and when it was 6 years old, it was diagnosed with autoimmune rheumatoid arthritis. What happened? They were crossing Baikal Lake. It's a huge lake in Siberia, and the dog fell through the ice into the cold water, and it got really, really sick. So for 3 months it was on painkillers, immunosuppressors. Basically, Lance, the name of the dog, it didn't have any function of the hind legs, and the state was so severe that basically the veterinary doctor said, the dog had about 6 months to live. It was that severe. So my friend Alexei here on the picture on the left, he didn't give up. He started to look and he found us. We had a coMra center here in our city. He got a device and he started doing the treatments. So what he was doing is Universal 3. I will show this protocol, which is treating the entire blood, the key lymph and the blood vessels points in the body. Then he also treated all major joints, because remember, with rheumatoid arthritis, Lance had really pain all of his joints, not just one or two, but all of his joints were so painful. Then he treated the liver, the adrenals, and he did the paravertebral scanning. So first month he did for hours every day. The treatments are very long, and if you open the user guide, if you go to Immunology 1, basically that's what he was doing. It was a treatment in the morning, midday, evening, and before sleep. He was doing all those treatments. Now the dog started to recover in about several months' time. It was walking slowly at first, but then faster and faster. So to cut a long story short, today Lance is 12 years old, and he returned to sports. He actually won several ski juring competitions. I was surprised. It's basically the type of sport where the skier would be pulled by a dog. So he had a very, very active lifestyle, and this is after he was given such a diagnosis. And Lance, really, this is how we met with Dr. Ulyana, because she was working with the Lance at the time, and she met Alexei and coMra therapy through working with Lance, actually. So smart animal, just, he doesn't talk, but apart from talking, he's Totally incredible dog. Okay, so how do we treat universal 3? This is the diagram from the human user guide. You can see the points. These are the key major arteries in the human body. And this is exactly the same in a human dog. Just put them in and on 4 and you'll have the exactly same picture. So here I asked Dr. Ulyana to do the treatments. We actually went to her clinic, and this is Lens. We did a video about a couple of weeks ago. So they have a coMra Delta device in the clinic. I mean, this is where they do the treatments when they bring animals in. And with the coMra Delta device, basically what you'll be doing is, for universal 3, you will be placing the device directly on the first 2 points would be the carotid arteries. You just locate in the middle of the neck, on the right and on the left side, 1 minute per point, 5 hertz. Exactly like in a human user guide. Nothing is different. So this is the carotid artery. So the next point would be axillary artery. You can find it in front of the body, in front of the chest, just below the shoulder scapular joint. Right there, yeah. So again, 5 hertz, 1 minute per point. Again, on the right and on the left on the body. Then the next point would be the elbow area. Again, like in a human being. And because it's a bigger animal, you can move it a bit higher. If it's a smaller dog, you can do it directly on the elbow area. So just inside where Ulyana is showing. Again, 1 minute per point. And the last point would be the femoral artery. It's about here. Yeah. So 1 minute per point. So that's it. It's really simple. It's universal 3. And for the cat, it would be really simple. Same points, just slightly different body size. Okay, so this is universal 3. Again, really simple to do. Okay, now from the universal 3 protocol, this is the, again, systemic treatment which we do for a condition like, for example, rheumatoid arthritis. Or we also will be treating for general well-being. We apply this protocol to treat when there is significant blood loss, significant injury to the body. This is a really, comprehensive protocol. Other examples I would like to show more specific, more localized treatments that sometimes also include universal 3. Now, I would like to warn you that some of those photographs are really graphic because I'll be showing you some of the wounds, and I know that some of us really, don't want to see our pet in such a condition, but sometimes it happens, and so I would like to show you, what kind of healing we can do. So if you don't want to watch it for the next, 5 minutes, you may look away, for example. Okay. So this is a case when a dog was attacked. So this is a homeless dog that was attacked, and upper left photograph, this is when the dog was brought to the clinic. Now this is the case study. It was done by students at the veterinary clinic of the University of Santo Tomas in Chile. And Georg, our representative in Chile, he sent us this case study. And when he worked with several students at the university, and they worked with cats, with dogs, with horses, some really amazing cases from Chile. So in case of Milagros, that's the name of the dog, this is what they had to deal with. It's a huge wound, really big wound. And luckily for the Milagros, the clinic had Delta device, and they began the treatment right away. Meaning after they cleaned the wound, you can see the day 1, they started to apply coMra therapy. So what they did is really simple. Again, nothing is difficult. Just do the scanning. You can see about 5 minutes per 10 square centimeters at 1000 hertz. That's all we did. And for 10 days in the clinic, they applied coMra therapy. During the first 3 days, it was several times per day, then it was 1 time per day. But basically, the first photographs showing you how the wound start to actually close. And day 10, this is when Milagros was, they found a new owner for the dog, they taken it to a new home. And the veterinary doctors, the students, everybody was so amazed and really excited, how wound was closing. Because it's such a large wound, the problem is that it wouldn't be healing. There would be huge scabs forming, and then later on you will see enormous scars. So when the Milagros came for a follow-up visit, you can see day 43 and then 146 days. The wound is closing really nice. There was no scar whatsoever. And the amazing part is that the fur, the hair follicles somehow were actually preserved. And the wound completely eventually healed without even a trace of this huge wound. So what you can see here is that, even without extensive surgery, and in this case, no surgery was done, no stitches were applied, we can really accelerate healing, and it's a high quality healing. That's what we want to see. Now, the second case of the also large wound on a dog's back. Again, very similar situation. Now, this is from the Altai University. So here the difference is that when the dog was attacked, it also had wounds on the back. Now, but for 2 weeks, there were no treatment, no coMra applied. And in the black here, you can see this black color. This is the scab is forming. Now, this is not a very optimal type of healing, regeneration. And typically what happens is that scab eventually becomes a scar tissue. And like here, for example, there will be no fur regrowing. It will be basically a huge scar area. Now, they began applying coMra therapy. It was a 9-day course at the clinic. So here they did also universal 3. Again, this is the protocol to support overall metabolism in the body, the blood. Plus, they did the scanning for 10 minutes over the injured area. So what you can see by day 9, the scab has naturally by itself fell off. You can see very nice granulation tissue building up here. You see this pinkish area. The second wound is also closing up really nicely. And then when the dog came for a follow-up, this is about 3 months later after the injury, it was a complete recovery. Meaning you see the nice fur. There is no scar tissue, there is no bald area, just very nice skin and fur. So the dog is full of energy, jumping up and down. Yeah, that's what we want to see with dogs, with cats. Really nice healing. Okay, this is a case of a Maine Coon cat. And as we know, cats love to climb. They don't afraid, to be on a really, high trees. Or in this case, the cat was on a 5-story building. Whatever happened, I don't know the backstory, but basically the cat fell from the 5th floor. So you can imagine the injury, the trauma. Now they brought the cat to a local clinic. They did the initial diagnosis. The pelvis was fractured. This is the X-ray. So basically the problem with the fractured pelvis is that it was fractured badly. And the doctor said that, well, ideally we have to do the surgery to rebuild the fractured pelvis, meaning that they attach the metal pins, but they cannot do it. There were several complications from the fall. The heart wasn't working really well, and it just was badly broken. So the only option was to do nothing. But the cat couldn't urinate, it couldn't defecate, it wouldn't eat. So, for 4 days, really, the cat was in a really bad state. So at this time, the cat owner really was looking through the city, and they heard about university clinic where Dr. Ulyana worked, brought the cat in. So they suggested, okay, let's try coMra therapy, and they started a 14-day coMra course. Again, the protocol, if you open the human user guide, was a universal 3, the blood, and they did traumatology 5, plus scanning over the injured area. Now here the recovery was amazing. Well, first of all, 2 hours after the first treatment session, the cat stood up. Now that was amazing, just with the amount of injury. And remember that the coMra therapy has a really good analgesic effect. Now the pain relief after the treatment is really good. I mean, I fell on my ankle, broke it when I was climbing, so I know how it feels. The pain relief is so welcome when you apply coMra therapy. So on the first day, the cat already, showed signs of recovery. By day 4, the cat was able to fully urinate and defecate by itself. It was walking around the apartment. It had appetite. So clearly, the recovery was really well on its way. And I mean, it was really amazing what happened on day 7. This is the middle of the coMra course. It was started to jump on a sofa. It was jumping on a windowsill. Again, this is not something veterinary doctor was expecting. Not on a 7th day. On the best day, it would be, let's say, after a month of recovery, the cat would be, jumping again. So, what we've seen here is that even in such a complicated fracture, and on a right X-ray, they did another X-ray to confirm that the bones are healing really well. There is a nice buildup of bone tissue on those fractured areas. So this is a cat. Okay, another typical problem, and now we're talking about Labrador. This is again, it's a big breed, big dog, so they have a tendency to spraining the ankles, the hips. So what happened here is that the dog lived in an apartment in a city, and this floor was it's really slippery, and the dog was running around. One day it slipped, and it really injured, it sprained the ligament in the knee and broken the toe. So for 2 weeks, the owner tried different medication. There was no improvement whatsoever. So when they brought it to the university clinic, and from what I understand, what Dr. Ulyana explained to me, with such severe injuries, 9 out of 10 cases, such large animal will end up with a surgery to rebuild the knee joint, to rebuild the sprained ligament, because it's such a complicated case. And well, not every dog owner would have such money. It's expensive surgery, plus the full recovery, again, not a guarantee at all. So obviously they began with coMra therapy. They did it for 2 weeks in the clinic. Again, same protocol, universal 3, which is the blood, plus you'll be doing treat the knee joint from the front, from the back, and then you would scan all around the joint. If you open this guide, it will be traumatology 3 and 5. The dog had fantastic recovery. For 8 months, it was in full remission. Now, Ulyana she actually said to the dog, to the owner several times, you see, because the floor is slippery and it happened once, it may happen again. This is one. And second, because it's such a severe sprain, you need to repeat the treatment about 4 to 6 months later. Now, they didn't come back for the repeat treatment session, but what happened is that in 8 months it slipped again on that same floor, unfortunately, and the dog came back again, hobbling. It wasn't as bad, no, but they had to repeat the coMra course. Now, 2 conclusions here. We can, with coMra therapy, really help the dog, large animal, to recover, to regenerate sprained ligaments. But again, you have to address the cause, the initial cause. Well, in this case, it was very slippery floor. But also, when it comes to the severe injuries, you need to think in terms of long-term recovery. Because yes, in 2 weeks we can do a lot, but the full regeneration, the strengthening of the tissue of the ligament takes time. Full recovery, it will take weeks, maybe a couple months, maybe 3 months for full recovery. So this is the situation when really, a coMra device at home would be the best case, especially when the animal is prone to such injury. Okay. So the next case I have, why I found it really interesting and to include here, is that sometimes we do not understand what's happening with the animal. We cannot be 100% certain about the diagnosis. So this is a cat, Sphinx, 4 years old, and it developed periodic clonic seizures. So sometimes all the muscles in the back would contract, and for hours it would really suffering. So I have here a video with one of the smaller seizures, but basically this is what happens with the cat. Hopefully you can see it. The muscles in the back would contract, and the cat sometimes wouldn't be able to walk, or it's really struggling to walk. So this is what happens. So when they brought the cat to the clinic, the first hypothesis, this was something in the brain, meaning it has a central origin, some disease or injury in the brain. They gave it certain medication to stop the, anti-epileptic basically medication, but there was no change whatsoever on the seizures. They still persisted. Okay, so the next hypothesis was something in the back. So they did the X-ray, but the structure was, as far as X-ray goes, the bone structure was healthy, normal. There was nothing wrong in the back. So perhaps something in pinching of the nerves in the back. It was a working hypothesis. So they started to apply coMra therapy by scanning, starting from the head all the way to the tail. Okay, the cat is hiding. They did the scanning from the head to the tail on the right and on the left, 1000 hertz for 4 minutes plus unit 3. Interesting thing happened is that after about a week of treatment, there was sudden swelling happening. You can see here in the yellow circle in the middle of the back, there was a swelling of tissue. It rapidly appeared and then gradually disappeared during the month. Perhaps something related to the injury, we don't know. But the good thing is that the cat was in full remission. So after 2 weeks of treatments, there were no seizures completely. Seizures were gone. So yes, we do not know exactly what was the reason or where exactly it was located, but we don't have to. As long as we have a hypothesis, in this case, something in the back, maybe in the spine, maybe in the vertebrae, maybe in a muscle, maybe in a tendon structure. We applied the coMra treatment and it worked. And that's what it actually matters in this case, isn't it? Now, 8 months later, seizures returned. They weren't as bad and as intense and as long. They were quite minor seizures. So the owner brought back the cat to the clinic. They did the course again, and now the cat is in remission, meaning there is no seizures anymore. So again, looks like a chronic condition, looks like a serious damage. It might take several courses to fully recover, to fully heal the animal. But the good thing again, the cat is much better. Yeah. Okay, so I did include one bird because it's such a different scenario. Even though it's not a household pet, it's a wild falcon, and this is the case. It was forwarded to us by Charles, our representative in South Africa. And he received this report from a rehabilitation center. They work with birds of prey. So this falcon was hit by a car. And when they brought the falcon to the clinic, they did x-ray, and obviously they saw, you can see on the x-ray, the right wing was fractured. So they did the surgery, they applied some pin, and they fixed the wing to allow the healing. And for about 6 weeks, the wing was strapped to the body, so allowed time to rebuild the bone structure. Because in birds, the bones are hollow, they're very light, and the healing of the bones is really problematic in the nature. So it's really difficult. But even after the bones were healed and they, allow the falcon to fly for the first time, the rehabilitation continued very slow. And what they said is that basically they can see that the wing was really sore and the bird was barely flying. So they had a delta, and they decided, okay, let's try coMra therapy. So they started a 3-week course. The protocol, really simple. If you open the user guide, and this is how we treat a bone fracture, meaning we treat it at 5 Hz, 50 Hz, and variable. 2 minutes at each frequency over the site of the fracture. So really simple protocol, and they started to see really good results immediately as they began the treatment. So what I included here, these are the tracked. They attached a GPS transmitter to the bird. So on the left, what you see is basically the track of the flying bird, but this is before coMra therapy. So the bird was barely flying. You can see its maximum altitude was only 20 meters. So it means, the bird wasn't really flying high. And the maximum speed is 55 kilometers. But for bird to survive in a wild nature, it has to fly really fast. I mean, this is how falcons are hunting. They need to fly really fast. So here, bird won't be able to hunt clearly. So after the coMra protocol, the middle picture shows here, start to recover. Now it's flying 350 meters high, and it's flying 80 kilometers per hour. This is right after the coMra course. And then a few weeks later, it's really recovering fast. So 155 kilometers per hour. It's flying high. So good recovery for the bird. And if you have parrots at home, if you have any type of birds, know for sure that we can, apply coMra therapy to treat wings, other bone structures as well, in birds as well. Okay, so this is a falcon. All right, so I have my cases, and I hope that you got some idea in terms of what kind of conditions you can treat, what effects you can get with coMra therapy. And while we're still working on a new user guide, don't wait. Take your user guide for the humans and just transfer the same points to your dog, to your cat, apply the treatment. Again, you can harm the animal. So really I'd like to encourage you. Now, thank you very much for submitting questions before the webinar. I do have about a dozen of questions, so I will answer them briefly. So, which device is best for the cancers in cats? Now, typically when cancer is diagnosed in a cat, that would be a really advanced stage. And if we're talking about advanced stage and really, you can see the cat is suffering, then coMra Palm is ideal device. The action of coMra Palm is really gentle, it's very gradual, and you will not stress the organism of the body into anymore with the cancer, because it's although the tumor could be localized in some area, it's actually the cancer creates a situation when entire body, entire metabolism is really struggling, because the immune system is really trying to attack the tumor to eradicate it. So what you can do is that you go to the user guide, you open the section on oncology and apply the treatment, and the coMra Palm would be the best device for this. Now, sometimes with cats and dogs, there will be done surgery to remove the tumor, and here we'll be talking about a recovery after the surgery. Again, if it's in a clinical setting, probably the best would be using a Delta device, 980 or 905. If it's in home settings, you can use both. You can use coMra Palm, let's say, for the first week after surgery to help build up gently, and then you can switch to coMra Delta if you have Delta at home. If you don't have it, just keep going with Delta device, and the recovery after surgery really would be fast. Okay, so what are the protocols for hens in keeping them healthy? Okay, so here we're assuming hens that you keep them for the eggs. Then what you'll be looking at is that we need to maintain a healthy metabolism in a bird to prevent loss of calcium in the body. Or typically that's the main problem. So what you'll be doing is that you'll again go to the universal section and look for the protocol for the so-called somatic biostimulation. That would be universal 4 and also universal 6. These are two similar protocols. So that's what you will be doing. You need to treat the blood, the heart, kidneys, liver, digestive tract. And you can split it into different sections and do each section on each day of the week. But again, the body size is much smaller, obviously, than human, so you can safely cut the treatment time in half. So instead of, let's say, doing 1 minute on the heart area, you can do 30 seconds. So, and that would basically be applying to any animal or a bird of this size. Okay, so this is regarding the hands. What about the treatment of cats for the eye infections? Okay, if infection is really bad, you might have to consider going to the vet. The vet will prescribe you maybe medication, maybe a cream, some antibiotics. But if it's not really bad, or you want to really speed up recovery, yes, you will be doing really simple 1000 hertz. coMra palm is more than sufficient, and you'll be treating, let's say, 1 minute at 1000 hertz both corners of the eye. And also scan along the bridge of the nose. This is where the infection often sits, in those glands that produce tears. So you'll be scanning the bridge of the nose and both corners of the eyes. But again, remember, keep the eyelids closed with a finger. The cat should not look directly into the eye. Now, the second question about the fleas, well, obviously, with coMra Delta, coMra Palm will not kill the fleas. You have to remove them mechanically by hand or other methods. But what you can use coMra is for the irritation in the skin. The cat would scratch sometimes behind the ear, around the eye, really, fiercely. And they would scratch the skin, so it even bleeds. So you can just scan with the coMra Palm where there is the biggest irritation. Let's say 5 minutes per area at 1000 hertz. Just scan around the area to soothe and to heal those scratches. So you can use it for that. Okay, the next question is, what about Cushing's in dogs? Now, Cushing's is a disease that affects adrenals. Again, go to the human user guide and you will see there's a protocol. But the basic idea is really simple. You need to find where the adrenals, they are just above the kidneys, sort of middle of the back, below scapula, and you can Google for the dog's anatomy, kind of locate where the kidneys are. And so your main point would be, let's say, 50 hertz, 2 minutes each adrenal gland. Plus, you'll be adding universal 3. So this is your basis. You don't have to think too hard. Just start with that protocol and you'll be good to go. Now, if the dog is really suffering, there's other issues involved, you might consider also treating the brain, paravertebral zones. Again, you have to look for entire picture, what's happening with the dog's health. Okay, the next question is about rabbits. Is there any limitations on rabbits? No limitations whatsoever. Use coMra devices without any concern. And yes, you can take the user manual and apply it to rabbits. Now, once we release the manual, the user guide for the cats, you can picture cat and a rabbit side by side. They're almost identical anatomy. Diseases, the organs would be very similar. So you can take basically the points, the protocols for the cat, and apply it directly to the rabbit. Very, very similar. Very similar. So really simple. How to treat, next question is how to treat arthritis in its legs. Cat is 17 years old. Yes, definitely treat the cat. You can treat at 50 hertz at variable, 1 minute front of the joint, 1 minute back of the joint. But again, open user guide, and you can see the protocol for the knee joint, for the hip. Just picture the human knee, transfer it to the cat, and maybe somewhat reduce treatment time, because obviously cat's knee would be much smaller than a human knee. The idea is the sample. Now, the cat is 17 years old, so add to the treatment by all means universal 3. Also treat the kidneys, treat the liver, treat the brain, treat scan paravertebral zone. The cat will feel much better, and it will have more energy. The digestion will normalize if there is any problem. So in any animal which is getting into its senior years, coMra therapy is fantastic as a preventative treatment. It's really good for the aging animal, so we really recommend it. And many of us at RLT and our clients, they will tell you, how coMra therapy is fantastic. Now, how to treat dog elbow hygroma? The same. In the beginning of my presentation, the Lance, the dog who was with rheumatoid arthritis, he had a huge hygromas. Similar treatment like would be arthritis for the joint. Very similar. Can Delta help with preventative measures, hip dysplasia, hind limb weakness? Well, this is exactly what happened with the Lance. Yes, it can. I hope by now that you have a good idea. How to speed up the healing and stop irritation caused by occasional heat rashes? Approach it as dermatitis. Open user guide. It's really simple. Just scan the swollen, irritated area. You might consider also some universal treatment as well. Again, look for the cause. Why the cat, why the dog is licking itself. Maybe it's stressed, maybe it's diet, maybe it's something's happening in the family and the animal is transferring on itself the stress. Okay, so this is all the questions I had pre-submitted to us before the webinar. Thank you very much. I'll stop sharing the screen now, and if you have any questions, comments, if you'd like to share your experience with coMra therapy, please, you're welcome to.
Arzhan, may I?
Hello, Mikhail.
Hello everyone.
Yes.
Well, first of all, thank you very much for the presentation and for the whole webinar. It's been extremely interesting to follow that. And when I was listening to the cases, what came up for me, it is a case of I think it's not exactly poisoning, but it's we had I'll just share what happened. We had a case. We have a dog. It's a small dog. It's a Parson Russell, so it's a relatively small and agile dog. And we were in Italy last year. It was March, I think. And we went for a walk, and there are actually these caterpillars, which were actually getting to life right then at that time, and they live in the Mediterranean, and we didn't know about that, and we actually happened to meet them, and they had fallen out of a tree on the ground, and Aria, the dog, she played around them and stuff, and then when we went home later on, she got very tired and apathic, and she didn't want to eat and just lay down, and she couldn't move. I mean, very quickly her state was getting worse and worse, and we didn't know what is happening, and it was actually at the evening in Italy in a small village. We didn't know what to do, and the dog was just, literally like dying, and she was just lying, not at all moving at all. So the first thing I did was I picked up the coMra. I had the Delta with us, and I started treating her. and I just treated her by intuition, you know. So I went for the arteries on both sides of the neck, and I did a lot of scanning on her vertebra as well. And somehow, you know, and then when I was petting her, I saw that she has a swelling or swelling on under her chin, on the yeah, under the head. And I started looking around what it could be. I found different things, but I couldn't understand what the problem is. And so she survived the evening or the night, and then the next day we went to see a veterinary, and she felt much better in the morning because she could already partially stand on her legs and walk. And then the veterinary actually told us about the caterpillars as one of the potential things. And then we understood what happened because we recalled the caterpillars that we met in all the event. And actually what happens when the dog get in touch with the caterpillars is that they have some poison which influences their nervous system. So basically it paralyzes the dog, you know. And when they lick, for example, the caterpillars, they can lose their tongue, which didn't happen in that case. But probably what had happened is that by intuition I had treated her back, you know, her vertebra on 1000 hertz with the delta, which is basically treating the nervous system, and then the blood as well. And this, I really believe, actually saved the life of the animal. So it was really amazing. And then she got an injection and you know, all the like medical treatment by the doctor, which was acute treatment or treatment for acute state. But I think coMra had already did a lot of work till then. So I really believe that coMra saved the life of our dog. So that's my experience, you know, with our dog.
Thank you, Mikhail.
Yeah. Thank you.
Yeah, coMra therapy has effect on actually really useful in situations when there's a toxic damage in the system.
Yeah, I think that was the case. The toxic damage, and which actually I think influenced heavily the nervous system.
Okay. Interesting. Thank you, Mikhail.
Thank you.
Yeah, in line with the poisoning, there's blue rock salt here that people put down in the winter, and it's not like regular rock salt. It has some chemical in it. And my mother-in-law's dog was out, and somebody in their neighborhood put down that blue rock salt, and the dog went over and was licking this stuff. And so she saw it, was kind of freaked out, didn't know what to do, and anyway, ended up taking the dog to the vet, and it had acute poisoning. And apparently, and I can't remember the time lapse, this was many years ago when we first started with coMra therapy, the bladder from the poisoning had collapsed, and they said, well, the dog won't live because once the bladder collapses, it can never come back, type of thing. So we said, well, we don't have anything to lose. Let's do coMra therapy on the dog. And it's a Keys hound. And so we started doing the treatments, and then all these black spots started to come up on her belly. And like the toxin was coming out from this, whatever that chemical is. So we just kept treating every couple of hours. And the dog lived for 5, 6 years later. And they said, you know, after they did the ultrasound, they said, well, the dog might live a week or so. So I'm just bringing that up, not only for the poisoning, but also we didn't know exactly what was going on. We suspected, I mean, it was pretty obvious, the blue salt, but we didn't have to wait. We just acted right away. So I just wanted to share that in that sense. Same as you, Mikhail. Yeah. Thank you.
Thank you, Garrett. And actually, you know, this point of having a coMra device for emergency applies for the human beings as well. You know, so many times I heard the stories, then somebody had a device and then had to wait until they go to the hospital. Yes, sometimes you have to go to the hospital, but you have to wait before applying it, especially if it's emergency. When
Yes.
tissue is damaged, when organ is damaged, every minute counts. when
every
you
minute.
apply coMra, it provides that energetic support. Basically it saves the cells from dying. So yeah, excellent example.
Yeah. And you know, the vet was shocked that the bladder actually could recover. They'd never seen that before. Yeah.
Mhm.
Okay, thank you.
Constance, hello. You have your hand up. Would you like to share?
Yes, thank you, Maxime. Arzhan, thank you for a wonderful, wonderful talk. It really was great and it clarified so much for me. I've been very nervous about treating the animal and I would go online and research dog anatomy to try and apply things, but I found the charts online very confusing about the dog anatomy. So I found the demonstration with Ulyana really helpful with the German Shepherd and seeing the correlations and what you did with the chart mapping human physiology and dogs. And so it was really, really good. And I would say my dog has an autoimmune condition. I have an autoimmune condition. So there we have a direct relationship. And I was wondering how to treat him actually, because he's going blind quite steadily because of it. So I will look that up when I come off this webinar. But thank you so much. It was wonderful.
Pleasure, Constance. Well, now don't be afraid. Go ahead and treat your dog by all means. And again, if you are uncertain about some points, send a message, go to the chat, whatever. We're here, Constance.
Thank you, Arzhan.
Pleasure.
And that's fantastic news. You're doing the book as well. I really look forward to that.
Treating animals is so rewarding because they show so fast, because generally they recover, they heal much faster, but with coMra they recover so much faster. One case just maybe a week ago, Ulyana shared with me, saw this dog with cancer, and really it's suffering, and cancer is inoperable, and the owner, okay, should we euthanize it or not, but dog is suffering. So they put palm on the head. They did just really basic, and at first the dog was like eyes is going, what's going on, and then you can see it's relaxing, and his head goes like this, palm, and it went to sleep. You can see the pain relief, so whatever we can to provide that quality. So coMra is there, and by all means, if you're unsure, if you don't know what's the disease, what's the condition, if you're unsure of the anatomy, it doesn't really matter. Just follow your gut feeling, your general understanding, and typically, especially if it's your cat, it's your dog, it will show you, where is the problem, where is the location, where it's something is off, the discomfort. Just put the delta there. Oh, the palm if you have it. Yeah. Oh, there's a question about will the treatment will be effective over the thin piece of cloth? No. The fabric will block off the radiance, especially the laser, the color LEDs, it will block it off. So you might consider it, doing a treatment when a dog is asleep, for example, when the eyes are closed, and not to wake up the animal. You can start the device if it beeps too loudly, put it on 10 minutes, start it away from the head, push the press start button, and then bring it quietly to the eyes and do it around the eyes if you're looking for the eyes. Yeah. Maxim, do we have any more questions coming up? I don't know, for maybe for the email or nothing. Okay. And I see it in the chat. There's also no more questions. Okay, we'll have the recording for you later on. Send it to your animal lovers, your friends, your local vet. And we'll make sure, you know, we'll work on that user guide. We'll publish it as soon as possible, and then we'll switch to the bigger animals. And again, working with the animals is so rewarding because they show you, you know, how they feel better. It feels so great. Okay, friends, thank you very much for joining today. Unless there's any more last minute questions coming up. Okay, thank you for joining. And I'll see you in the next webinar. Thank you.
Thank you very much, Arzhan.
Very
Thank
good.
you, everybody.
Thank
Thank
you.
you.
Okay,
Bye.
Bye.
Thank
Bye.
you.
bye for now.
Thank you.
Bye.
Bye-bye.
Well done, Arzhan.
Bye-bye.
Bye.